Every once in a blue moon, a person touches your heart and forever transforms your perspective on life, while tackling medical challenges the average person could never fathom. Billy Crawford offers that sort of inspiration. He meets difficulties with courage and optimism. When a fungal infection ravaged his face after chemo left him defenseless, he miraculously survived. Then went about restoring his physical features, all the while touching everyone in his path through his positive outlook in the face of daunting obstacles. Listen as Billy tells his story.
May the 2nd, I can remember getting out of bed that morning. From that part, got to move forward about 3.5 weeks that I don't know nothing. When my wife, my mama, and my sister and my wife got me ready and took me to the hospital. And when we got there, they asked my wife, do you want to put him on life support?
Because of his immune system was compromised due to his chemotherapy, he contracted a fungal infection. His wife actually had documented pictures that it was over the course of about 4.5 hours that he had lost that degree of the soft tissue of his face.
But somehow, by the grace of God, they give me the right stuff to stop it. When the doctors came in and told me that I had just a very short time to live, because my face was black from the center of my forehead all the way down here. In fact, when I woke up, a doctor that had been doctoring on me for 6 months before this, he came in my room and he introduced himself. And I said, you don't have to introduce yourself to me. He said, what? And I said, you don't have to introduce yourself to me. I know who you are. And he said, have I doctored on you before? I said, yeah, about 6 months ago. And I told him, he looked at my chart and he said, Billy Crawford. He said, oh, man. He said, what has happened to you? And I said, I don't know. And he said, have you seen yourself in the mirror? I said, no. He said, I don't think I would if I was you, because I'm afraid you're going to go into a deep depression. They kept me in the hospital as long as they could, and then they moved me to rehab. And I went home, and my dermatologist, he called a couple of 2 or 3 days later and wanted to know how I was. He figured I was dead. And Lois told him, said, he's in there watching TV. He said, what? And Lois said, he's in there watching TV, he's all right.
He is a wonderful man, and in this field we get to build relationships with patients. It's not just one appointment, it's numerous appointments that you build trust with each other, and you have one-on-one time, appointments that last 3 to 4 hours, and he has been an inspiration to really all of us in the clinic, and his wife, the family support he has is amazing. So we all had to work as a team to really find the best way to give him a facial prosthesis. There are many innovations now using rapid prototyping, navigational surgery, and other digital design softwares that would be able to help us in our preoperative planning to give the patient the best outcome. And due to a prosthesis of that size, we would hope to use implant retention. Our first step would be to plan the best location for those implants.
Well, we had a challenge. This is a photograph of the patient, probably taken about a month after the implants had been placed. And our object was to try and get 4 implants above the eyes in what we would call a supraorbital position, 4 on the lower orbital rims, and 2 around the base of the nose. So if we had tears, which are essentially just saltwater solution, draining down around our implants, we could get a soft tissue reaction that could cause the implants to fail. So we had to plan, Susie had to plan for the drainage, some way to collect those tears, keep them away from the implants. Probably the best thing of all is the patient's attitude and his family's support, both of which have just been incredible.
Everything was planned virtually, and the first time I had to take a clinical impression was after his implants had completely healed. The last stages over the last 2 months was when I created the prosthesis. We paired his CT data from the CT he acquired prior to losing his face with his other CT he had prior to surgery. And by manipulating those two data sets, we worked with engineers from a company called Medical Modeling to create a prototype, then duplicating it and bringing it into the clinic. So there's a lot of one-on-one time you spend with the patient. The retentive components of the prosthesis is really magnets that are embedded in an acrylic substructure. Those are then embedded into the wax sculpture so that I could snap it directly onto the patient and sculpt on them. This allows them to be able to move around. We can look at it at all different angles, and they can give me their feedback. After you have a mold created, it is then addressing the color. I'll do a color session with the patient. We had about 16 different intrinsic colors to create, matching all the different colors that are found in our skin, and those are then painted into the mold intrinsically in layers, down to every freckle and blood vessel and age spot that may be found in his skin characteristics. Afterwards, the silicone is then cured in the oven. Then it comes out as a flexible silicone prosthesis. Color is then added on the outside, and all of the hairs from the eyebrow and the mustache were then inserted individually or sewn in. So the use of technology really has enhanced his treatment, but I think all in all the success of his treatment is based on his wonderful positive attitude and the faith he's had through everything. It's really not just a physical adjustment, but it's an emotional adjustment, and we started that emotional healing in the very beginning. So not only did he have to adjust to losing his face, but also gaining one again. And that it is a prosthesis. It's something he still takes off every night when he goes to bed and puts it on in the morning.
I want to be able to drive my car to town and get out and visit some of my old buddies and go back to church. And I want to do testimony at the church, what God has done for me. And I want to get back in life again.